In today's video, we're going to continue our discussion on all things diet and arthritis. This is the second part in a two-part series on the topic, and in this video we are going to be talking about whether nutrition can improve your arthritic symptoms in isolation or whether it needs to be done in conjunction with a rehab program. We're going to talk about glucosamine, chondroitin and other supplements, and we're also going to touch on some myths and misconceptions when it comes to diet and arthritis. You don't have to watch the videos in order, so stay tuned for this one if you haven't checked out part one already. And we're going to start right now. If you haven't checked out part one already, just a mini introduction to Ben. Ben Steele-Turner is a physiotherapist and a nutritionist with a special interest in osteoarthritis, so he is the perfect man for the job when it comes to talking about this topic. He's got lots of useful information for us, so let's hear what he has to say. We know that when it comes to treatment and arthritis, that the strongest evidence points us towards a specific tailored rehab program and weight loss, if appropriate. Now, there are some kind of lesser evidenced treatment interventions that could be used, so things like manual therapy, anti-inflammatories, or even TENS machines. There has been some evidence for those as well. But the evidence says that really none of those things should be used in isolation as a sole treatment for arthritis. They should all be used in conjunction with a rehab program and considering weight loss as well. Do you feel that when it comes to nutrition and diet and arthritis, that people can get a reduction in their symptoms by solely focusing on diet and nutrition? Or do you think that, again, that's something that should always be used in conjunction with a specific rehab program?
Absolutely. I mean, I am a physio and a nutritionist, so really the heart of my practice is that things should be done in a combined way. Exactly like you said, things like supports, manual therapy, non-steroidal anti-inflammatory and a host of other things are things that are kind of tools that we could use to reduce OA symptoms. However, I think that the strengthening exercise, the activity modification, the if needed weight loss, they're really the gold standard. So we want to start with those three and then look at the others. There's a really nice diagram published by NICE, the National Institute of Clinical Excellence, and it's like an archery target, and that target kind of has everything that's the tools that we can consider for using for osteoarthritis treatment, and it's that strengthening, the advice, education, activity modification, and then weight loss when needed, which is the bullseye. So they're the ones we want to focus on, and then we can use the others as and when we need, as and when we think it's appropriate based on what the evidence says and for the individual that's with us. So for you, the patient watching, or the patient that you're with, do you think that treatment's going to be helpful for them? And then combining them in the way that you think is going to be most appropriate. So I think to answer that question, because I went a little bit around the houses there, I think if your diet is really bad and you improve it, you may well notice an improvement in osteoarthritis symptoms. Certainly anecdotally, that's quite a common thing. However, it's not the sole thing you need to think about. It as always, it's one with many, but definitely there can be improvement. But to give the best possible chance of the maximal improvement, it needs to be a combined approach.
Now, I was really keen on asking you about a couple of things today with regards to supplements. Now, these are the two supplements that I get asked most about. I don't know if you do as well, and I'm sure people watching will be keen on knowing. Now, they are the use of glucosamine and chondroitin for arthritis. Now, the reason I'm asking not only is because I get asked a lot about them, but also because as evidence-based clinicians in the UK, we try and adhere to the NICE guidelines. So that is the National Institute of Care Excellence, and they basically put together evidence-based guidelines for many conditions for us to use with our patients. Now, they specifically say that they do not support the use of chondroitin and glucosamine because there is a lack of evidence in the area. So my question is, what do you think about this? And what do you say to your patients when they ask you about the use of chondroitin and glucosamine for their arthritis?
Yeah, so great question. Glucosamine and chondroitin have been probably relatively well, or for a long time, thought of as beneficial for OA. You're absolutely right. NICE guidelines say don't recommend it. There's a paucity of evidence, so not much evidence on that. There are the view on that, to give you a little backstory. There was kind of some older studies that seem to point towards glucosamine and chondroitin being helpful, and so the legacy of that was quite long lived, where people felt we were making some progress, but then more up to date research has maybe disproved that or made it seem less important. However, one caveat I always say with glucosamine and chondroitin is it seems to be really have a huge anecdotal impact, that some people who I see are either take glucosamine and chondroitin and they absolutely swear by it. And I don't know whether that's placebo effect. I don't know if perhaps there's something about those individuals where it is more beneficial. I don't know. So I would say, unless you have a reason not to take glucosamine and chondroitin, and one instance of that would be if you're on blood thinners such as warfarin, that would be a reason not to take glucosamine and chondroitin. I wouldn't recommend someone to start taking it if they're not already. However, if a OA patient is already taking them and feels they are beneficial, then I wouldn't be jumping straight on the message of you should stop taking them. I would try and build other things in rather than take that away.
That's brilliant. I'm sure that's cleared things up for a lot of people watching. Now, in terms of keeping things short and sweet, I'm just going to ask you one last question, and that is, I noticed on your Instagram page recently, you highlighted this potential conflict of interest when it comes to the health and fitness industry, because we're trying to help people, but we're also taking money from them. Now, that in itself probably isn't too much of a problem, but for me, probably what that has led to is a lot of misinformation, a lot of inaccurate information. And we can see that when we look online. There's lots of things claiming to cure and fix people's pain, and we know that just isn't the case. So whilst you're on the video, are there any significant myths and misconceptions when it comes to nutrition and diet and osteoarthritis that you would like to share with people watching?
Yeah, I think as with so many areas of the fitness industry, healthcare industry, absolutely full of myths. You're completely right. I don't know of any specific myths that I'm aware of with OA. Just the general myth is that always over-reliance on one factor. So if as we've already kind of touched on with the combined of physio, nutrition and varied treatments, if somebody's claiming that one thing, whether it's getting rid of one food type, one ingredient, or adding in one food type, one supplement, one ingredient, if that's the answer to everything, that's likely untrue. Nutrition is a hugely complex thing with so many variables, different inputs, and so many variables. If somebody's claiming that changing one thing is going to help everything, that's probably not true generally in the nutrition space, and including OA. Apart from that, there's no other clear myths that I would say per se. I think anything that's the one ingredient and anything that goes against the general hitting your macronutrient targets, that's protein, fats and carbs, making sure you're getting all your micronutrients, and then going from there alongside your physiotherapy with your strengthening, modifying your activity, that's the way to go. And probably generally we know that's the right thing to do, at least with current knowledge, that is the gold standard treatment. So anything that goes against that probably is not going to be the best information for you.
Okay, cool, that's brilliant. Now before you head off, if people watching want to come and find you and have a look at some of the great content that you're putting out, where's the best place for them to come and find you?
So best place to find me is Instagram. I get moaned at all the time for spending far too long on my phone. My handle is @physiutrition, which is a very unimaginative mash of physiotherapy and nutrition, just put into one word. PHYSIUTRITION. That's probably the best place to access the information I put out. Absolutely feel free, send me a message at any point on there. I'd be more than happy to talk all day about subjects like this.
A huge thank you to Ben for his time today. Hopefully you've gained some really useful knowledge from his expertise in today's video. There is some great stuff about how nutrition and diet can help your osteoarthritis. If you'd like some more help with your arthritis, then there's some useful links in the description below the video. There's also some other great videos on the Genuine Physio YouTube channel. And if you are new around here, then please don't forget to subscribe to the channel so you get notified every time I release a new video, which I do every single week. And if you're feeling very generous, then please do give us a thumbs up to show your appreciation. If you did enjoy this video and you haven't checked out part 1 already, Ben and I discussed whether diet is important when it comes to arthritis, and we also discussed some of the things you should and shouldn't be eating if you have arthritic pain. There's a link in the description below to the video. But you may also like the video that I have put together on hip arthritis exercises, and there is a whole playlist on the channel to help you manage your arthritis better at home. Thanks again for watching, and until next time, I will see you again very soon.